All, this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. I hope you had a great weekend. Let's very quickly just look at the disclaimer. This is, in summary, not a medical advice, is not a patient-doctor relationship. We are going to talk about some of the COVID-related items and more as an education and information and nothing else. So let's start a discussion. The topic that I wanted to discuss today are number one, the vaccine-related clotting and the reduction in that number after the age restrictions. I want to share that. Secondly, the UK vaccination death rate, or the death rate in the vaccinated folks. There have been so many rumors and media cycles and tweets and stuff like that to say there is somehow a problem and vaccinated people are becoming more sick, they're dying more and so on. There is some crazy number like 750 times more viral load and 251 times more viral load and so on. These are misinterpretations. I wanted to once again look at the data together instead of looking at the media's interpretations. You can look at the data with me and then you can make up your own mind and you can make up your own opinion for what you are seeing there. So that is the second part. And the third part I wanted to discuss is the situation in Pakistan. We have very rarely talked about Pakistan. These are two of my countries. I am originally from Pakistan and I am a US citizen. These are the two countries I speak a little less so that folks don't think that I'm just talking about my countries. So let's talk about Pakistan today as well. There are some very interesting cases that I wanted to share. So with this, let's start. I hope everybody is doing well, and let's start a discussion. So first one, here are the references. This is the reference, it's Reuters. Age restrictions on AstraZeneca shot have ended reports of rare clots in UK. So there's a study in UK. This is, look at the date here. This is August 11. So it's an old news. August 11, there is a study that shows that once the UK offered or put an age restriction on AstraZeneca vaccine, the reports of clotting have gone away in Britain. This is what I had been talking about for months and months and months to say we should be wise about this. And here is a proof of what I was saying. Then another topic about the UK's death rate. So for example, here is a opinion piece. It is not a news, it is not an article, it's an opinion piece. High death rate among vaccinated brings vaccine dystopia into view, and totally misinterpretation of the data here. Then here is the data, which is that article about, this is another set of data, so it's taking time to refresh anyways. These are all the references that are present in the description as well. Let's just very quickly go over these data points. So first of all, vaccine-induced severe clotting. We know that we had seen in the past, and we had looked at the studies as well, that adenovirus-based vaccine may cause, in rare cases, but they may cause severe blood clotting, and that actually caused some of the patients to die as well. So there is a study that found that AstraZeneca, 85% of the blood clotting cases because of AstraZeneca. So imagine if because of AstraZeneca there is a reports of 100 cases of blood clots, 85% of these are in individuals that are younger than 60 years of age. Although the AstraZeneca was given at that time more to older age folks as well, still lesser than 60 developed 85% of the clotting issues. Then the other important thing is that the 50 years or lesser had the chance of clotting 1 to 50,000. And I know that there had been a lot of comments by those folks who wanted the vaccines to not be criticized they said that, hey, very rare, doesn't really happen and so on, and this should not be something that should stop us, and the actual COVID can cause more damage, and all that is good. But my point had been that if we know that this is happening, then we should take steps to try to manage it or avoid it. And here you are seeing a study. So when UK actually restricted AstraZeneca for the age below 40 to say, try to limit the use of AstraZeneca for lesser than 40 years of age, what happened was the cases of blood clot have almost disappeared in the UK. And please remember that these folks who were developing clots, 23% of them were dying. So there was a high rate of mortality there. And so I love this thought from UK. UK has been doing a lot of groundbreaking decisions. So they made a decision about this, and they have good outcome for this as well. So this is the first news for today. The second part, Pakistan. Then we'll go to the UK and look at the death rate data as well. It is a little more involved, so I would look at that later on. So Pakistan is once again in lockdown. Their population is 220 million people or more. I think they have a total of about 1 million cases and a fewer number of deaths compared to similarly populous countries in the world. Number one, what Pakistan has done is that 15 to 18 years of age, they have just opened up the vaccination. However, the vaccine that can be given to this age is Pfizer. No other vaccine is approved to be given to this age. I think that's an interesting decision. Secondly, in Pakistan, Ivermectin is very often used. And so Ivermectin is almost disappeared. Now people have to pay a lot to find Ivermectin and to get Ivermectin, and many pharmacies are rationing it. So they're saying, I'm only going to give you 3 doses for 3 days, and that's about it. I don't have more. Or it has become very expensive, or it has just not been available anymore. So Ivermectin is kind of not there anymore. Now, another thing that is really interesting, and I would go over some cases with you for this. Another thing that is interesting is that those who have been vaccinated, and in Pakistan, there have been a lot of people who were vaccinated with vaccines that originated from China. Nowadays, Pfizer, AstraZeneca, Moderna, and other are available as well. And here is an interesting thing. Those who are vaccinated, majority of them, the ones that have been talking with me or with the students who are my students, or the doctors who have been my students and they discuss their cases with me, most of the time, the infections in the vaccinated have become upper respiratory tract infections. To me, this actually tells, so this is the opinion part, so I may be wrong. My opinion part is that the virus and the vaccines, I would consider previous infection as well, that is helping with enough protection that the virus is now becoming more like a flu or common cold. Common cold is less severe, flu is more severe, and I think SARS-CoV-2 is a little more severe than the flu as well. So, but it is becoming something like that. And I'm seeing more and more patients who have upper respiratory tract infections. And this reminds me, remember the Oxford study that they did with AstraZeneca or CHAdOx1. And when they challenged the animals after vaccinating, when they challenged them with the virus, they observed that upper respiratory tract infection occurred, but lower respiratory tract infections did not occur. And they came back and they said, the vaccine seems to not protect from becoming a new case, but it is protecting them, the animals, from lower respiratory tract infection and possibly death. We are seeing similar phenomena now, that with vaccines, even when the reinfection is occurring in more healthy and less comorbid people, the vaccines are actually causing more upper respiratory or resulting in more upper respiratory tract infections if a re-exposure occurs. That's very interesting. And I would consider the same thing with the previous infections as well. So upper respiratory tract infections, in which the most common symptoms I'm hearing: scratchy throat, painful throat, hoarseness of voice. They find it difficult to speak. Runny nose in some, headache in even lesser number of people. Oxygen saturation, at least in the healthy groups who are vaccinated and are reinfected, I'm not seeing their oxygen saturation dropping. That is very, very interesting. Anosmia is very common. Anosmia is very common. Lower respiratory tract infections are less. Severe fatigue is very common. I'm seeing a lot of patients who, when they discuss with me, or the doctors who are discussing their patients with me, that the patients are, or the doctors who themselves have the infection now, they're just sleeping and sleeping and sleeping, and they're fatigued and they're tired. Oxygen drop is less. So if you think about it for a second holistically, it seems to me that after a previous infection or after a vaccination, when the immune system learns to handle this virus, then the virus gets enough window of time to replicate in our upper respiratory tract infection. And by the time it is trying to go to the lower respiratory tract infection, it takes it a few days to travel down. By that time, our immune system has started taking care of it. So lower respiratory tract infections become less common. That means it is kind of becoming more flu-like, which would be a good news. If this is an observation at scale, then this is a good news. Now, I want to discuss some cases with you as well from Pakistan, which can highlight similar observations that I showed. So a few cases recently that I have been interacting with. First one, 74 years old, vaccinated, just became reinfected, I think about a couple of months after the vaccine. And I think the vaccine was from a Chinese company. Oxygen saturation stayed 94 and above. No issues with the oxygen saturation. Did develop some symptoms, but you would see here in these cases that the youngsters developed more symptoms than the older people who were vaccinated. Developed cough, fever, weakness. Blood glucose went very high after the medicines were started. So I think it is because of steroids. And then severe bradycardia, because this person was given remdesivir as well. So in many parts of the world, remdesivir is just now used as a standard. Steroids are used as a standard. So this person's management was, so they told me what this person's doctor was doing. They're giving them famotidine, steroids, remdesivir, ivermectin, enoxaparin or blood thinners, and then other symptomatic treatment. There is no issue with oxygen at all. HRCT had very tiny, small one signal, and that's about it. No issues there either. Chest has been clear, mostly upper respiratory tract. And the patient has been moving around. So that is very interesting for me to see a person at this age group and responding this way. And now it is, I think he is on 10th or 11th day. His family said to me that, hey, we asked him to take rest and we asked him to, eat healthy, but he's eating everything and is moving about, which is actually a good news. Now, second person. This person is this person's son, 52 years old, has diabetes and less controlled, was infected. And I was in touch with them when he got infected last time. Actually, he was very, very grateful last time that he thought some of the intervention that I had done had saved his life. Last time he was in a lot of trouble. Oxygen was dropping. He was not able to move about. He was severely fatigued and had cough, had difficulty breathing, chest was not clear, HRCT was not clear, and some of his friends had told him that he is in trouble. And his best friend died during the same process. And I remember that when that happened and when his best friend passed away, and how difficult it was because he wanted to go there, but he himself was sick as well, and so on. So he had a lot of trouble last time. And this would be about middle to third quarter of 2020. Then he got vaccinated. And then about a month ago, 15 days ago, he got reinfected. He got reinfected because he attended a crowded event where I'm sure that he caught it from there. Now, when he got reinfected, how did he get PCR positive declared is because the other people around him, they were getting sick and they went for their test. And so he went for his test as well. And he was asymptomatic this time. So there was nothing. He was totally asymptomatic. They did PCR and they said, yes, you're positive again. And he had nothing. So even for medicines, it was like, okay, we are going to give you these medicines, but there are no symptoms. That was very, very interesting for me to observe, that somebody who has a comorbidity that really causes problem and had an infection, then a vaccine, and now got reinfected, but asymptomatic. This person, his wife, last time she actually had lesser symptoms. Her total symptoms, or symptom, I should say, symptoms were headache and cough. That's it, nothing else. She had the same exact set, headache and cough, chest clear, HRCT clear, no other issues, no fever, no tiredness, nothing. Vaccinated, then got infected, got vaccinated, and then got reinfected now. The whole family got reinfected together. She, once again, headache and cough, and that's about it. Last time she had headaches as well. Their daughter, 24 years, doctor, goes to wards where she gets exposed to virus as well. I mean, they take care of the exposure, but possibility for exposure. Female, vaccinated. So she also developed infection last time in that third quarter. Interestingly, she had a longer period of symptoms. She had a little more severe symptoms compared to her father and her mother last time. This time as well, she didn't have as severe symptoms as her father or mother or grandfather. She actually had more severe symptoms. She had fever, she had cough, scratchy throat, painful throat, could not speak for many days, runny nose, and now she's recovered after about 6 days. Same treatment that I think this individual didn't have steroids. So other than steroids, ivermectin, famotidine, Fexet, enoxaparin, and some other vitamin D and other such things. And she's fine. She had the similar set as last time. But once again, it is interesting to see that none of them, I've seen all of their HRCTs, I've seen their labs, none of them developed much lower respiratory tract problems. Then this is another set of individuals. This person is my student. He's a doctor now, and he lives remotely. So for example, if I am from Cupertino and I'm working, let's say in Massachusetts, so I go there and live there in a dorm with some other friends as well. 24 years old, he is obese. Last time when he became infected, before the vaccine, he became infected in last April-May timeframe, 2020. It was really hard. I was really scared when he got it last time because his oxygen was dropping. He is obese as well. He would not be able to walk about, talk. When he'll call me, he would speak two sentences and he would then stop. He would not go to hospital. In those days, Pakistan's hospitals were overwhelmed as well. It was tough. And at that time, the medication he took was hydroxychloroquine, zinc, and those. So I believe last time in 5-6 days, he was able to come out of this severe situation, but he then stayed fatigued for a very long time. Then he got vaccinated as well. Then last week, he got sick. And interestingly, I called him just in general to say, hello, how are you doing? And when I called him, he said, I have cold. I said, are you sure it is cold? He said, yeah, I am. I had the infection, then I'm vaccinated as well. I don't think I have COVID. I have cold. I said, okay. Next day, he called me and he said, sir, I have a problem. I cannot smell anything. So I said, I think you have COVID. So he got his test done and he was positive. Now, the friends that he was living with, they did not develop it, only he developed it. Oxygen saturation did not change at all. Majority of the problems he got was throat ache or throat pains, scratchy throat, runny nose, and severe tiredness and fatigue. No issues with oxygen levels, just weak. And 3-4 days later, his friends, so I had asked him to quarantine, but I think people have become quite tired of quarantining or so whatever is their current mindset, he did not. And now all of them are sick. There are 4 friends that live together in a house that they've rented. So now all of them are sick, but all of them have upper respiratory tract type infection. They're all vaccinated. Anosmia is in him. Severe fatigue. He says, I keep sleeping for 12 hours, 18 hours. Today he called me. I had asked, how are you doing? And he said, I slept for 18 hours and I did not even know. Cough, scratchy throat. He said, my anosmia could not go away. I had said that my observation is that with full dose ivermectin for 4 or 5 days, anosmia goes away. And he said, I tried to get the ivermectin, but I only got it for 2 or 3 days and they would not give me more because they're out of it. And he said, I'm trying to figure it out. No issues with oxygen saturation. So I would not call it like common cold. Common cold is, in many cases, we can just simply run about, do our things, even with the common cold. This is, I think, even more intense than flu. But majority after vaccination, upper respiratory tract infections. I would consider, I'll keep saying, previous infection is going to act similarly as an immune training. And so when the virus would land and it is now replicating and destroying our tissue, and by the time it has done some symptoms, our immune system would wake up and take care of it. So other infection or systemic infections would be less. This is in a normal, healthy individual. Of course, folks who are probably too weak or the immune system is not that well, or their immune system is not well trained and so on, they may not be able to mount a similar response and they may have more severe infections. And we know people with the previous infection have been reinfected and ended up in hospital and dead. People with the vaccines also can end up in a hospital and die as well. However, it is very interesting for me to see this shift in symptoms and to see how it is just becoming lesser intense compared to last time. So these are some of the cases. Now I want to look at the UK's data. So here, data review. So every time I review data, there is always some folks who say that data is not correct or it should be looked at differently. So my recommendation is to look at that data with me, then look at it by yourself as well. And one more request is that when you look at that data, you think it should be interpreted differently. A better way to articulate that is to say, here is the data I think, and here is what I think is the interpretation. Here may be where you misunderstood, instead of just yelling and cursing, because that drowns out your own voice. So with this, let's look at the data. I'm going to give you just a taste of how UK's data is being seen at the moment. So for example, here, I'm just going to read a couple of sentences to give you an idea. I'm getting tweets and I'm getting a lot of messages. So look here. For the period of February 1 through August 2, there were COVID Delta variant cases for 47,000 people who had received 2 vaccine doses, and for 151,000 people who were unvaccinated. In the first group of vaccinated people, there were 402 deaths. In the second, much larger group with more than 3 times unvaccinated people, there were just 253 deaths. And then he goes on to say that this means that infection rate is very, very high in vaccinated people. So I don't want to read the rest because it is an opinion piece and it's also not something that is interesting. I want to look at this data. So here, this Excel sheet, and I would try to increase the size so that it's not an eye chart. But give me 1 second. I want to show you where this data is coming from. This article, this opinion piece, and they say it is an opinion because if you read here, note that the views expressed in this opinion article are the writer's personal views and not necessarily those of trial site. This article is currently free to read and share without paying. So opinion and opinions, I'll offer my opinion and I could be wrong as well. So again, when they say explicitly it is an opinion, for us to try to discredit it as something else is incorrect. So this is an opinion here. This link here, a new report, that link is linking to this report. SARS-CoV-2 variants of concerns and variant under investigation. This is 6 August. And here down in this area, there are some discussions about death rates. So this is the basis for that article. So I have that over here. This link is present in the description as well. Then I have some more data here. This data is by the ons.government.uk. And if you see here, infection remained level, hospital admission, deaths around in 4 in 5 adults are fully vaccinated, 9 in 10 adults had antibodies, social distancing remains level. So this is some data, and I took some parts from there. There is one more link here about this data. And if I just increase that, you can get a basic idea of what I'm going to show. But here, if you see here, this green line is actually the death rate in vaccinated. So it's actually that opinion piece that we just saw was not very accurate. And I'm going to show you the data here. Then this is another link that shows various cases. For example, people who have received second dose, people who have received first dose. So if you wanted to go day by day to see how many people received doses, that data is there. And then there is a study, English study finds 50% reduce. There are too many ads here. So with this, now let's look at the data. This data I downloaded from here. This download the data. This is the data that I have here. So let's look at this data, how it is structured before I zoom in. How it is structured, actually, let me zoom in. On this side is the date. Then if you see here, for example, unvaccinated, number of deaths in them, for example, in January, population that was unvaccinated still, because it was very early on for vaccination campaigns, 37,803,000, so about 38 million. Number of deaths were 4,788 in unvaccinated. Rate of deaths per 100,000 was 14.3. And then they have a confidence interval as well. This is how they have structured the data. So this is the structure in which I'm going to look at this data with you. So what is important for us to look at is the rate of death per 100,000. So for example, on 8 January, more population was unvaccinated. Rate of death per 100,000 was 14.3%. Cases is not an interesting number for me, at least. And the reason for that is we just saw, just like Pakistan as well, people are vaccinated and they're getting reinfected. I am seeing that everywhere. And I had been talking about it, that this vaccine, it cannot just block the virus from entering our mouth and nose and eyes. So expecting this vaccine to just block the virus altogether, unless our immune system is just really hot after the vaccine, maybe a few months after that, it would be really, really revved up, and it could reduce the the infection almost to asymptomatic or just not even occur. But generally, there is going to be reinfection. And that question is, how about the severity? So here is the severity, 14.3%. Then if you see, as the vaccination continued to occur, the number of unvaccinated folks continue to reduce. So here there are 36 million, 34 million, and just keep looking here, the rate of death in those who are not vaccinated. I'll go to the right side and compare this to the rate of death in vaccinated, and that is drastically low. So if you keep going, let's go to the latest days. 2 July 21. So this is not till August, this is till 2nd July. 35 deaths. Population that is still unvaccinated is 10 million. So out of about 9.5 million. Out of 9.5 million unvaccinated folks, there is going to be an X number that are the cases, and then there is 35 deaths. That is 1.6 deaths per 100,000. And the confidence interval is here, 1 to 2.3. Those numbers that have a U in front of them, they are saying that this means this data point is unreliable because the data point is very small. So you could ignore U if you wanted, or you could use U as well. So here, 1.6% per, not percent, per 100,000. Now let's go to the same information, but let's look at 2 doses first. This is deaths 20 days or more after the first dose, and this is second dose. So let's look at it. Now the population that is vaccinated is more. 23.3 million people are vaccinated. There are 63 deaths. The percentage is 0.2%. Confidence interval is 0.1 to 0.2. 0.2, again, this is not percentage, per 100,000. 0.2 per 100,000 would mean 1 death in vaccinated people out of 500,000 vaccinated people. If we go back here to the unvaccinated individuals, then what we are saying is 1.6 deaths per 100,000. So almost 50 or 60,000 unvaccinated individuals, there will be 1 death. If we go back to the second dose and post second dose vaccinated individuals, and we said 500,000 individuals who are vaccinated, 1 death amongst them in this duration. If we extrapolate that for the unvaccinated number, that would mean that for every 100,000, there will be 1.6. So 500,000, 1.6 plus 1.6 plus 1.6 plus 1.6 plus 1.6. So that will be 3.2 and 3.2, 6.4 and 1.6, 7 and 8. That will be 8 deaths per 500,000 versus 1 death per 500,000 in vaccinated. So there is a huge difference. Let's look at the first dose as well. deaths within 21 days of the first dose. So if you see here, number of deaths are 0. So I don't know exactly why. So I'm going to leave it. That's 21 days or more after the first dose. So 13 deaths in 4 million population, 2.1, and they say it is an unreliable number. But I would still, the good thing in data here is that they have separated it and looking at it separately. So it is one dose and after. The death rate is high here. It's not low death rate. But once complete vaccination is done, then it seems like death rate is really low. I had said in the past, and I make these comments and I become I take the brunt of making these comments as well. However, I had said it may be interesting to reduce the distance between the two doses, because it is one dose and after, maybe in Delta's time, it is too much time. However, because I don't have data to say if the two doses were put together more closer, what will be the outcome? I don't have that data, so I can only opine. I cannot say this should be done because I don't have data to back it up. So this is the data. Now let's go back and look at some more data here. Let's choose a time here. For example, this 0.6%. This is 18 June, 13 deaths. Population at that time that was unvaccinated was 10 million. And then that is 0.6 per 100,000, not percent. I keep calling it percent. If I go here towards two doses, then if you see 29, population is 22, 0.1, so almost half, but again, unreliable. If you see here, this data in vaccinated individuals, death rate has only been really 1/10 of a percent, 100,000. So it's a very tiny death rate. And you can see it this way as well. If you count them all, they are 306. The problem with counting this way, vertically or chronologically, is that the population continues to change. As more and more people are getting vaccinated, the population is changing. So if you get this number, what are you going to offset that to? What are you going to combine it with? Are you going to say 10 million's population or 23 million's population vaccinated? That is the problem with doing this. So plus there is another issue with the numbers that we are seeing. These 63 deaths are actually offset by maybe a month or 6 weeks or 8 weeks, depending upon how the person is being managed and what is their situation. That means it's not really a one-to-one combination here. Still, I think that the distance or the change in the population in shorter intervals, in let's say 1 month type intervals, is lesser compared to taking 10 million to 23 million and then say 24 to 63, a total of 306. Now, what number should we use for vaccinated population? Should we use 10 million or 23 million or an average? Because of that, I think it is not and same is the case for unvaccinated as well. So meaning I'm not taking any side here. If let's say, number of deaths here, if all of these are 260. Now the population is 15 million and now 9 million. So what population to offset this to, and so on. Anyways, what I wanted us to look at the data, at least the latest data, to see how vaccination has helped or not. Now, when I look at this data and I look at folks summing these numbers up and then talking about the population there has to be a care. I actually read one of the UK government's article in which what they did was they took care to say, out of the population who were vaccinated, let's take them out, and then who were not vaccinated, and then let's do the comparisons. And they had a more precise mechanism to discuss and calculate the 100 per 100,000 deaths overall. I don't think we have that data here. And we cannot just simply say, you know what, this is the population, let's say 15 million. And then we say there were 216 deaths out of 15 million. That would be an incorrect number. So I wanted to make sure that we can look at this number and we can understand that the percentage or the death rate per 100,000 in unvaccinated is still very high, 1.6%, 1.2%. Again, I'm saying percent, please change that to 100,000 in your mind. It is very high compared to vaccinated. So this is the discussion for today. I'm going to come back and we would do one more discussion, and that is the remdesivir and the bradycardia, or the mechanism of possible cardiac toxicity because of remdesivir. The reason I wanted to discuss this is that the individual that I showed you, the 74 years old, he was given remdesivir and he developed severe bradycardia, 43 or so and lesser. And because his granddaughter herself was a doctor, she became very concerned. They ended up in an emergency. So I wanted to make sure that we all, whoever are the healthcare professional here as well, we realize that what remdesivir can do in terms of cardiotoxicity, what is the mechanism of that, and what is the management of that, how are doctors managing this. So thank you very much, and I will reappear in 5 minutes. And meanwhile, please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. You can buy me a coffee, or you can become a patron, or you can use PayPal to support this work. Thank you very much, and I'll see you in a few minutes.